Here in the United Kingdom we have a lot of strikes, a lot of people very angry apparently about not receiving the money that they believe they should receive. Step forward first of all, the nurses, the NHS, those are the people that we all got onto our steps for every Thursday evening during the pandemic to clap. Now I was very keen on this simply because I was clapping for the hard workers. For me, the truly hard workers are the cleaners, the assistants, the people that work in the catering, and of course the doctors and nurses on the very lowest rung of that pay ladder. Not too keen on the managers and the people above. And it's interesting, isn't it, the way the mainstream media paint this particular picture, particularly again of the national health. Let me explain the reasons why. When they talk about the national health in the mainstream media, they're always painted as just about crumbling, in crisis, can't cope. Nobody mentions, of course, the influx of migrants that are instantly receiving attention, medical care, tablets, whatever they need the minute they arrive. Now, I'm not suggesting they shouldn't, but this is an added sort of bonus, if you like, of work on top of the usual situation that doctors and nurses find themselves in. The same with GPs. When you look at where they place the migrants, particularly in these international hotels, the 3- and 4-star hotels that are now jam-packed with migrants, they're all receiving medical attention directly from the National Health Service. Why doesn't the mainstream media mention that? So we look towards the BBC, who recently on their bulletin at 6 p.m, primetime news bulletin, was headed by the health editor, Hugh Pym. Now, Hugh's been at the BBC some time and has wonderful dark hair for a man of his age. But what was interesting, in my opinion, was this. He decided to interview a nurse, Debbie Wilkinson. And Debbie apparently, on camera, vocally said that the 4% pay rise offered was simply not enough. In fact, her words were, it was a slap in the face. Now, Hugh's a big, long-standing journalist. He should have done some due diligence, tested out exactly where was Debbie coming from. Now, of course, he made no mention of the fact that she was from the Unite organisation. That's right. She never mentioned it at all, you see. And also, he failed to mention the fact that she was an avid Corbynista. That is, of course, the former Labour Party leader, Jeremy Corbyn, an avid fan. What I'm suggesting as ever with all of these stories is, and I do point this out to you, the people watching out there, they're simply not balanced or fair. Because when you think about it, of course, the NHS is in crisis. But as I've pointed out, we're getting an influx of people that we didn't bank on. There are no more staff because there's not enough money within the system. But the icing on the cake that the BBC failed to mention in this big report, on the same week that apparently Debbie felt the 4% pay rise simply wasn't enough, the National Health Service are advertising for 7 diversity managers across the United Kingdom. Salaries starting at £108,000 a year. So it's not really a problem because while they can't treat you, put a bandage on or solve your mental health, at least they can get your pronouns right. That should work. So once again, don't you think the BBC, ITV, Sky and all of those international channels about the world who are literally scaremongering people into thinking the world's about to end really should show both sides of the story? Someone like Hugh Pym at the BBC, I'm utterly bewildered that he let this report go out without doing, as I say, the rightful due diligence. I'd love to know what you think to this particular story in the comments below. Should you really be trusting the mainstream media of any story now? Do they all have their own narrative? And more importantly, is it now up to you, the individual, to find out the truth behind the headlines? Neil Sean in the very heart of London.